everybody. Welcome back to the show. My name is Ashley Cooley. I am the host and owner of Birth Baby Sleep, where we support individuals from bump to beyond, basically. In today's episode, I am speaking with Dr. Cassandra Connolly. She is a naturopathic doctor here in the Halifax area, and her focus is really on supporting women, new growing families, expecting parents, on having a healthy pregnancy, healthy birth, healthy postpartum period as much as possible. And so that's what we're talking about here today. And if you'd like to continue these conversations, you have questions for either myself or maybe Dr. Cass, and we want to chat a bit more, please feel free to do that in our Bringing Up Baby community. It's free. There's a link in the show notes, or you can find us at birthbabysleep.ca/community. All right, guys, without further ado, here's my conversation with Dr. Cass. Hi, Cassandra. How are you today?
Hi, Ashley. Good. How are you?
I'm good, thanks. Cassandra, you're a naturopathic doctor. I didn't hear about naturopathic doctors until I moved to Halifax, a little small town girl over here. And when I started seeing naturopathic doctors, I kind of started realizing like, oh, this feels like not to me at the time, it was like alternative health, where I feel like it's more like a complement to what is out there currently. But it always intrigued me how different it was to connect with, chat, and get some information from a naturopathic doctor. So, curious if we can start with we're really talking about today about having a healthy pregnancy, postpartum experience as much as possible for the birthing person as well as for their babies. But what are some of the reasons why someone might want to see a naturopathic doctor during their pregnancy?
So kind of like the first way that I like to explain things to patients is naturopathic medicine is kind of seen a little bit differently depending on where you live in Canada. So I'm like from Nova Scotia, born and raised in Nova Scotia, went to school in British Columbia. And naturopathic medicine on the West Coast is seen as doctors are your primary care physician. So that means a lot of people are turning more towards naturopathic medicine, looking for natural alternatives to things, and still have their GP almost the reverse as a complement for any acute needs. So if they need, specialized testing, referrals to specialists, they tend to use their GP for that. But the reason why there's a difference across Canada is basically BC all the way to Ontario, the scope of practice for naturopathic doctors is very different. So naturopathic doctors in the western part and kind of the middle part, I guess, central part of Canada, can do lab requisitions. They can prescribe medications. They can refer to specialists, certain specialists. They can order x-rays and ultrasounds. So with the shortage kind of being nationwide of people having doctors and there being a lot of naturopathic doctors that are, quote unquote, in private practice, people are tired of waiting for to see specialists, right? So waiting 6 months to a year or whatever the case may be, or in our specific topic today, there's not enough midwives. There's not enough gynecologists anymore. So what happens is people will go to a naturopathic doctor, kind of get the information they need, get the treatment they need, and use the conventional medical system kind of as a supplement. Now we move all the way to Eastern Canada and it's the reverse, right? So in Nova Scotia, one of the big shockers for me when I moved back was we really are still seen as alternative doctors.
Mm-hmm.
And most people go to their GP, and then we're kind of a complement to their GP. And there's nothing wrong with that. But part of my job as a naturopathic doctor is really educating the public as to what can naturopathic doctors do. So across Canada, we are considered primary care physicians, which means that you can come to me as your first contact in the medical system if you don't have a family doctor. So I think the numbers now in Nova Scotia are still over 100,000 people don't have a family doctor. And people will commonly call my office or email me and say, like, can I see you as my physician for my pregnancy, for my postpartum needs, for my fertility needs, so on and so forth? And the answer is yes, because we are trained very similar to general practitioner, so like your GP, right?
Hmm.
So
Hmm.
we have to have a science degree to get into medical school. We go to an accredited medical school. There's 7 in North America, 2 in Canada, 5 in the US. We have to pass rigorous board exams. We have to hold malpractice insurance. We have to be licensed, right? So a lot of times people will say like, oh, I thought I'd just go to a naturopathic doctor to get some herbs or to ask about magnesium or calcium. And our reach within what we can do is so much bigger than that. And our scope of practice is changing every single year to start including more of what Western Canada is including. So as we get those things added to our scope, like prescription rights, like blood work referrals, referring to specialists, I think you're going to see more and more people look to turning towards naturopathic medicine because of the shortage of doctors. Now, that being said, I always educate my patients on you shouldn't, in my opinion, you shouldn't have just one physician. You should have a team, right? So naturopathic doctors, as well as your GP, as well as somebody who does body work. So whether that's a chiropractor, an acupuncturist, an osteopath, massage therapist, and somebody for mental health, right? So looking at having, a counselor, a psychologist, somebody. So a well-rounded medical team consists of those people. And those are really patients that I see that thrive because they're looking after every aspect of their health. One person
Mm.
doesn't have all the answers. So that's kind of the caveat, I guess, in the beginning of to like what is a naturopathic doctor and what can we do. So naturopathic doctors in pregnancy can do tons of things, right? There's very few naturopathic doctors in this province actually that really love treating prenatal and postpartum care. You'll see a lot of doctors say like they like to do women's health, but then when it's prenatal or postpartum, they might refer you out to somebody else. My passion as a mother of 2 young wild little boys is very much in the postpartum and prenatal era of life, so that perinatal period. I had one child in BC and I had my second child in Nova Scotia, and the difference in care from Western Canada to Eastern Canada was mind-blowing.
Mm.
I found prenatal and postpartum care was substantially better in BC than it was here, right? So after I had my second son almost 4 years ago and having him and going through the system, especially during a pandemic, really changed my focus of practice. I used to do a lot of women's health and dabble in prenatal and postpartum because it was very natural to me. But now I've literally revamped my whole practice to devote it to moms and kids. So my unwritten mission statement, I guess, would be like, I don't want any other mother left behind because I felt left behind during COVID.
Mm.
And there is just so many moms that are struggling.
Yeah.
So you
Yeah.
can come to a naturopathic doctor for literally anything in pregnancy and prenatal. Like if it's life or death, I would say no, go to the hospital, right? But if you are having trouble with figuring out what type of supplements you should be on, asking questions around like, is this the right prenatal for you? Do you have morning sickness? Do you have nausea? Do you have weird rashes popping up? Are you not sure if you're eating enough or eating the right foods? Do you have a history of gestational diabetes, or are you worried about gestational diabetes? So that's diabetes within pregnancy.
Hmm.
Do you have a history of having difficult pregnancies and you want to kind of change that this time around? Are you having trouble even getting pregnant, right? So there's so many things that we can cover that the public, I find in general, just doesn't even know about.
Mm. That is so, yeah, so enlightening. So many things to talk about. Like the fact that naturopathic medicine could potentially, in this part of the country, really help the shortage of doctors and all that's going on
Yes.
there. That's just
Mhm.
that's huge in and of itself. When it comes to a prenatal appointment, and typically we're going to our GPs or OBGYNs or whatnot, and they're using, at a certain point in the pregnancy, they're using the Doppler to check on the baby and things like that. Is that something that you would do in an appointment, or you're just really primarily focused on the birthing person and what they need, so that any checks with the baby would have to be with a medical provider? Does that make sense?
Yeah, so really the way that it works is you kind of come in for your first appointment. People have come in at various stages in their pregnancy. Some people are literally like just missed their period
Hmm.
and they're just finding out they're pregnant, and other people are like 20, 40 weeks along. So a lot of it is around education, kind of sitting down and talking to patients about if this is their first pregnancy, what is kind of the pregnancy timeline look like? So I educate people on like, okay, this is when you're gonna have your first ultrasound. This is when you're gonna have your anatomy scan. This is when you get tested for gestational diabetes. This is when you get tested for GBS. All these type of things. We go through nutrition, we go through mental health, we go through everything from like supplements you're on to supplements maybe you should be taking. We also do physical exams. So to answer your question, measuring the stomach, the fundal height to determine the age and the size of the baby as you progress in your pregnancy. We are allowed to do Doppler checks. We don't have access to an ultrasound machine, so that clearly has to be done at the hospital. So like that dating ultrasound, that anatomy ultrasound, which are like the two main ultrasounds that are done unless there's some complications. And then other than that, really, there's nothing else to check on the baby, right? Because everything's checked through ultrasound. So yes, there's mothers that come to me for their checkups on their fundal height and to listen to the baby's heartbeat all the way through their pregnancy.
Mm-hmm.
And then also looking at the mom, right? Measuring the mom, making sure the blood pressure is okay. So taking blood pressure checks. So really anything again that you would do with your GP in terms of like basic prenatal care can be done in a naturopathic doctor's office.
Amazing. That's amazing. Looking for the best for your baby? Atlantic Canada's baby store is here for you. Nurtured, which is right here in Halifax, Nova Scotia, has the best products for baby. The staff are so incredibly helpful, and they have the most top-rated car seats and strollers you won't find anywhere else. So whether you need expert advice or the perfect baby gear, Nurtured's got you covered. And guess what? Nurtured's giving Bringing Up Baby podcast listeners an exclusive deal. Get 15% off your order from nurtured.ca when you spend a minimum of $75 using code BUB, B-U-B. Brand exclusions apply, valid now through till November 30th, 2024. Nurtured, supporting your parenting journey every step of the way. Let's jump to like what symptoms in pregnancy. You've touched on a little bit of this already, but what symptoms in pregnancy can be eased or avoided altogether with naturopathic medicine? Like what have you seen in your practice and those that you're working with that, hey, this stuff really worked with morning sickness or some other aches and pains or anything around pregnancy?
Yeah, so there's a lot that can be done. So nausea, very easily fixed with naturopathic medicine for most women. Morning sickness. I mean, morning sickness is on a scale. You can have it from mild to like really, really bad where you're hospitalized. So, more of the mild to moderate cases can be done with naturopathic medicine. Looking at a big one is gestational diabetes. People really want to know like how do I eat to decrease my chance of getting gestational diabetes, or there's a lot of questions around what do I do for exercise, right?
Mm-hmm.
So exercise, which really helps with a lot of the symptoms, right? So getting the blood moving so you don't have swollen ankles. It helps with nausea, it helps with headaches, it helps with back pain. So there's a lot around like physical symptoms, just kind of your body's changing, you're growing another human, right? So hard on the back, hard on the legs, that type of stuff. So looking at mitigating those physical discomforts through, talking about exercise, just regular ergonomics, lifestyle factors, how to sleep differently with pillows, all that type of stuff. Nausea, morning sickness, headaches are really, really like kind of the three big ones that people come time in and time again.
Mm-hmm.
In pregnancy, another one is looking at any type of urinary tract infections or possibility of bladder infections. So you are at an increased risk of having urinary tract infections when you're pregnant, just due to the change of the vaginal microbiome. So the good and the bad bacteria that kind of exist can shift.
Mm-hmm.
And we don't want urinary tract infections or bladder infections during pregnancy because they can cause preterm labor. So having women coming in and saying like, can you test my urine? And the answer to that is yes. So, it's just like the hospital, just like a GP's office, we give them a sterile cup. They go and pee into it. We test their urine and we see if they have a urinary tract infection. And then depending on what's going on symptom wise, can we catch it early with herbs, or do we have to resort to medication if it's, if it's too high up in the urinary tract. So there's literally lots of things, right? Fatigue, because a lot of it comes down to women shifting how they kind of function, right? When you're 30 weeks pregnant, you need more rest, right? So a lot of the things in pregnancy don't require medication. Yes, there's definitely some situations where you need the medication, and that's where, your GP can help you, and we can't in this province yet. But there's a lot of things just between like exercising, sleeping better, using pillows, changing what you're eating or including other things, hydrating a bit more, that really look after a lot of the symptoms that people are worried about during pregnancy.
Here's a question for you. Let's pretend I'm your patient, because I'm wishing now that I was way back when. With all three of my pregnancies, I developed a fun little thing called PICA, where and it happened every time at around 22, 23 weeks of pregnancy. I started craving. PICA is when you crave non-nutritive substances. If you Google this, some of the things that will come up are kind of disgusting and scary. Like I think feces is one of them. Coal, dirt, laundry detergent, chalk. Like these are things that people will look at and be like, oh my God, I want that in my body. Luckily, mine felt the safest. It was with ice. I looked at ice cubes like I'd be at a restaurant and a waitress is bringing a glass of iced water to a table and I'm like frothing at the mouth. Oh my God, get me that ice. Or I used to buy those party bags of ice and eat it like chips at night. Like that's what I was doing, sitting on the couch, eating chips, but it's ice. And then it was winter time and I'm walking and I look at a snowbank and I'm like, oh my God, I want to dive into that snowbank. Like, how weird is that? So when it first happened with my first daughter, and I was like really it was just like, oh, this is something I'm noticing. I'm really like into ice. I mentioned it to my doctor, and she went right to blood work that I had recently to look at my iron. And she said, well, it's in the normal range. So, nothing wrong. But clearly I'm thinking maybe there was like, I'm someone who's kind of low in iron even when I'm not pregnant. And so I found with all three of my pregnancies, it happened at the same time. Restless legs was another one, and it's something that I still struggle with. And again, I think that's related to iron too. So if somebody came in to see you with restless legs or something like pica, what would be those things that you might suggest? Or like, would you immediately go to iron? Like if my iron was within the range, I know there can be big ranges with this. I'm assuming it was towards the lower end because I was obviously experiencing symptoms like that. Anyway, what's your take on that?
I've had people come into my practice with pica, and it usually is ice, actually. So it's kind of funny.
Good, we're all in the
I'm glad they're not chewing on like cigarette butts and everything else
I
they could be
know.
chewing on. But yes, usually it is iron. So I usually get some blood work, make sure the other nutrients are kind of falling into proper range. But like you said, iron has a fairly big range, and there is a quote unquote within range normal, and then there's optimal.
Mm,
So when people are not sitting in an optimal range, they can still have symptoms, right? So, but yes, restless legs is another thing that is really common in pregnancy. And it again is usually linked to iron.
hmm
Sometimes it can be linked to a bit of a magnesium calcium or an electrolyte pictures, something skewed there. But a lot of the times, I'd say probably 7 out of every 10 cases that I see, when we start getting iron in, the restless legs slows down.
Did you know that laboring in an upright position is associated with faster labor times and a decrease in the rate of interventions? Like I'm talking up to a 25% decrease in C-section deliveries alone. I know for me, I'm constantly talking about and demonstrating different ways to use gravity in your favor during labor in our prenatal classes, and the birth sling is part of that discussion. It safely holds up to 400 pounds, it's easy to clean, and it comes in a few different colors. So if you'd like to get your hands on your own birth sling, use the link in our show notes and use code BIRTHBABYSLEEP at checkout to receive $10 off your order. That's thebirthsling.com with the specific link in our show notes, using BirthBabySleep for $10 off your order.
We've been talking a lot about the pregnancy and healthy pregnancy, feeling as best we can. Does any of this stuff help, or do we need to do anything extra? Think about anything else when it comes to that early postpartum period, knowing how hormones are going to shift. Sometimes a lot of that stuff's out of our control, and that's what I like to talk to people about, like what's normal, what's common, and what are some ways you can work with that. But from your perspective, are there like supplements or things that you find are really helpful in that postpartum period? Or again, I know it's can be very individual, but just curious if you have a general sense of them.
I guess the biggest thing I would say is like, yes, pregnancies are so individualized. They can be so different. I mean, you probably know from having 3 children, like all your pregnancies, you might have had some similarities, but they were all very different, right?
Oh
Just like
yeah.
when your
Oh yeah.
kids are born, they're all very different. Sometimes I look at my 2 boys and I'm like, are you guys even related? Because you're polar opposites, right? The biggest thing is that pregnancies, we can try our best to have as healthy of a pregnancy as possible. But there are so many things that we don't have any control over either, being the biggest thing being genetics, right? So, we don't know unless we look at your genetics, whether you are predispositioned to gestational diabetes, whether you're predispositioned to having big babies or little babies, whether you're predispositioned to having some form of mental health concern after birth. One of the biggest things that I like tell people is really you just have to do your best and trust your gut, right? If you really want to eat a piece of pie every single day for the last 3 months of your pregnancy, because that's when your cravings start, for example, go for it, right? It's not a time to, indulge and have like, dessert 5 times a day and no nutrients. But a lot of people get so hung up on having to have the quote unquote perfect pregnancy. And it's more of look at what you're doing 80% of the time. Are you getting up and at least going for a walk around the block or up and down the stairs? Are you eating whole grains? Are you eating fruit and vegetables? Are you drinking water? Are you making sure you sleep? Are you avoiding alcohol and drugs, and cigarettes? Very, very basic things can create a beautiful pregnancy. It's not all the bells and the whistles and the people that go to see a naturopathic doctor and the people that have, the top line of supplements are the only people guaranteed to have a perfect pregnancy. It's more of how can we optimize everything to give you the best running chance of having a healthy pregnancy, with the caveat of knowing that things can change, right? That's one thing that I find when people start to talk to me about, oh, I don't have to have the perfect, fairy tale pregnancy. It decreases a lot of the stress that can cause kind of that mental anguish. And then leading into postpartum is, I don't think in most of probably North America, I have a lot of friends and family in the US and they kind of talk to me about the same thing. So I'd say in North America, probably in general, it's probably safe to say we do a really, really poor job of looking after moms in postpartum.
Oh,
And
yeah.
like I said, kind of in the beginning of our talk today, that is what ignited the passion in me after my second son was born. I did the regular checkups, went and did all the stuff that I'm told to do in the conventional system, and I was missed and spent 2 years in a postpartum depression. And it's after I kind of came out of that postpartum depression, and I tell my patients this all the time because, just because I'm a naturopathic doctor doesn't mean I'm immune to not getting these things either. And it was after this period of time where I was like, no more people are going to slip through the cracks if I have anything to do with it. If you're in my care, I will do everything possible to make sure you don't slip through the cracks, because those were the scariest 2 years of my life. And I am an educated individual who works in this field, and I still slip through the cracks. So it terrifies me to think of people that don't have any medical background or people that don't have this type of training and don't know the signs to look out for. How much further are they going to slip before they are caught? So looking at in my practice, when we go through a perinatal visit, there's a very like set schedule of when I see you, kind of similar to when a GP says, I want to see you on this week. And then the closer you get to having your baby, the more frequently you see a doctor because you're closer and closer to birth.
Mm-hmm.
That being said, we start postpartum care conversations in my practice at 6 months pregnant.
Mm.
We talk about, okay, what does your support system look like? Do you have a support system in place? Do you have a meal train? Do you have family that can cook for you? If not, can you make one recipe a week in like batch recipes a week and start freezing the food now when you still have the energy? Because we all know that as we get more and more towards having the baby, the more and more tired we are. The larger we are, the harder it is to kind of navigate around the kitchen and have the energy to, you know, sit at a stove and make a massive pot of spaghetti sauce, for example.
Mm-hmm.
Right? But looking at all of those type of things, talking through, okay, this is what you want as a birth plan. If this doesn't happen, are you going to be okay mentally?
Mm.
Right? A lot of women
Mm-hmm.
come to me after having a baby and they're distraught that their birth plan wasn't the plan that actually happened. So really mitigating those things by talking about them early on and saying like, you are just as important after pregnancy as you were when you were pregnant, right?
Mm-hmm.
People will do almost anything for somebody when they're pregnant. But then as soon as the baby is born, it's like all the attention's on the baby and where is the mom now?
Mm-hmm.
Right? And so looking at
Yeah.
those cultures that have the 40 days after pregnancy, I wish North America was like that.
Mm-hmm.
Everybody caters to the mom. The mom stays in bed and heals and rests. And her job is literally to nurse the baby, nurture the baby, and feed herself and nurture herself, right?
Mm-hmm.
But
Mm-hmm.
looking at, you know, great, what if people are going to come over, what are they going to do for you?
Mm-hmm.
Coming over and holding your baby really doesn't help you because most moms want to hold their own baby, right? If you're going to go over to somebody's house who's just had a baby in that postpartum period, come over with a dish of food in your hand.
Or don't come at all.
Yeah, or don't come at all, right?
I
Call
talk
them
about
and
that
ask
too,
them.
Cass. I say like, you want helpers to be there the first couple
Yes.
weeks, people that are gonna like, sure, if you want them to hold the baby or something, but they're gonna unload your dishwasher, they're gonna get the laundry
Yes.
in the dryer, they're gonna
Go
prep a
get your
meal or
groceries. Play
go
with
get
your
your
other
groceries.
kids, right?
Yeah,
Like
those are
if
the
you
people we want early on, and the people that just visit can come later.
Yeah, and really look at having those people kind of set in stone and having those conversations. If you have an aunt, a mom, a best friend, a mother-in-law, whatever the case is, like having those conversations with those people before the baby arrives,
Mm-hmm.
right?
Mm-hmm.
And knowing that like you need that support. That, you know, people say, oh, I can do everything on your own. This is not a time to do everything on your own because you are trying to heal, right? Having a baby is equivalent to running the Boston Marathon.
Mm.
Right. And
Mm-hmm.
so if I were to say to you go around the Boston Marathon, you'd look at me like, yeah, right, I'm not going to do that. Well, you just did it if you had a baby and now you need to recover, right? It's
Mm-hmm.
having a baby is like going through an athletic event. You recover from every athletic event,
Mm-hmm.
right? So really paying attention to that postpartum period, having, you know, there's a postpartum program that it's a very skeleton right now because I can do it on the fly because I've done it enough. But I want to have something kind of set in stone that I'm working on currently in having, you know, the kind of like the paperwork there for patients of mine to be able to read and say, okay, I'm feeling like this. It's time, you know, it's time to call Cassandra, or I'm feeling like this. I need to
Mm-hmm.
reach out to this support person, right? So really looking at not only getting yourself through the prenatal period and your pregnancy and all the beautiful things that come with that, but also looking at how are we going to create the most beautiful postpartum period as well. And people
Yeah.
think postpartum is only like 2 to 3 months after. You're
Yeah.
postpartum for the rest of your life. Once you've had a baby, you're postpartum, right? So
Mm-hmm.
people will say, oh, can I only see you for a year and then like I can't see you anymore? It's like, no, once you've had a baby and you're postpartum, you can continue to be my patient. And then a lot of times I also treat pediatrics, right? So children
Mm-hmm.
are a huge part of my practice. It's probably, you know, roughly 50% of my practice is looking after the children of the women that I
Mm.
saw in pregnancy, or women find out about me after they've had kids and now I'm looking after them through perimenopause and menopause and all that type of stuff, and then also looking after their children. So it becomes this beautiful relationship where I've seen you from the time you were pregnant to the time you had a baby, and now I see all your children too. So in terms of supplements, there are things that people should just basically be taking. Vitamin D, everybody and their dog knows what vitamin D does, right? So vitamin D is really important for your immune system, your gut. It allows you to absorb calcium from your food better, which is really important for little developing bones that your baby's trying to grow. As well as low vitamin D levels are linked to premature labor. So a lot of North Americans are walking around with suboptimal vitamin D levels, right? So getting your vitamin D tested and seeing where you sit is a great idea, especially if you've been pregnant most of the winter and or you work inside, right? Our windows and our doors in office buildings all have UV filters on them. Or if you're somebody who wears a lot of sunscreen and you're always, in turtlenecks and things like where you're just not, your skin's not exposed to the sun. Probiotics is also a really big one. So probiotics, there's 101 million different types of strains of probiotics. And so kind of getting one that suits you can and that your gut likes and tolerates can be a little bit of a challenge. So working with a naturopathic doctor to figure that out is a great idea as well. But probiotics are really, really important for the baby's gut as well as the mother's gut. So the baby's gut is determined by the mother's gut. So if the mother has poor digestive health and poor gut health, there is a chance, a higher probability of the baby being born with gut health. So taking a probiotic to kind of help the baby develop a microbiome. One thing that people don't tend to know about is a baby's microbiome is fully kind of given to them when they're birthed through the vaginal canal. So they swallow the microbiome that from the mother as they kind of go through that vaginal canal and come out into the world. So babies that are born by C-section don't get that opportunity and are usually need probiotics as an infant more often than not.
Speaking of that, have you heard of something called vaginal seeding?
I have. There's not a lot of research around it yet. It's kind of there's kind of some new up and coming stuff around the vaginal seeding part of things, as well as I don't know if you saw recently, the regular medical profession is starting to give credit to not discarding the placenta and looking at the placenta as a means of figuring out kind of what the history. It's almost like, I guess the best way to put it would be like they're looking towards it as a blueprint to kind of figure out more about the child you just birthed, right? So what important information can we develop from the placenta? Some people do placental encapsulation because the placenta is full of nutrients. Another thing is fish oil. So a lot of people know fish oil equals brain development. Fish oil also decreases your chance of preeclampsia. So preeclampsia is high blood pressure in pregnancy that can be very dangerous due to the increased pressure on the heart and the arteries, as well as the protein levels that can accumulate in the body, in the kidneys. So preeclampsia is a medical emergency, but you can reduce your risk of preeclampsia with regular intake of fish oil. So vitamin D, probiotics, prenatal, and fish oil are kind of the basics, and then everybody's kind of tweaked from there, right? So
okay, that's what I was going to say. Like, yeah, sorry. A lot of those things are in prenatals, but maybe not quite to the level that we need them at. So adding on.
Yeah, usually probiotics are never really at the level. Vitamin D sometimes, depending on the brand, some only has like half of the dose that you need. Fish oil tends to be quite generic, right? If somebody has a history of mental health stuff, then a lot of times it's vital that we put the vitamin, or not the vitamin D, sorry, the fish oil at a higher dose, so on and so forth. So there's some very basic ones that people should be on, and then there's like the tailored ones depending on what else is going on with that individual.
Wow. This has been incredibly helpful and enlightening. I don't plan on getting pregnant again, but if I
Me
did,
neither.
I would certainly come to you, just with all that knowledge and additional things that you can help support with. And like you said, they're longer appointments, so you really develop a rapport and get that support. So speaking of, where can people find you?
I am on the internet in terms of I have a website, a booking link. So it's Dr. Cassandra Connolly, nd.com. And I have a physical office in Tantallon. So I am in the little blue kind of strip mall building beside Home Hardware across from the gas station and the superstore in Tantallon, just like right off the highway type of thing. Dr. Cass _ND is my Instagram handle. And you can also find me on Facebook under Dr. Cassandra Connolly. The other thing is a lot of people ask me, well, what if I don't know if I want to work with a naturopathic doctor yet, or I don't know if you can help me with what is going on. Then I tell people to book the free complimentary meet and greet kind of consult. So it's a 15-minute appointment that you can book in. You can chit chat with me, get to meet me. You can do it over the phone or you can do it in person, but you can just generally say like, this is what's going on. Can you help me or not? Some people kind of want to know, like, can you give me a 5-minute rundown of what an ND is, what an ND does? I've heard from, my mom's sister's aunt that I should see one, but I don't know. So those are there to kind of help answer those questions and support those individuals along their decision-making process of whether they want to work with a naturopathic doctor or not.
Perfect. Perfect. Well, I'll link all of those things, your website and everything in the show notes to make it easy for people to click and find you.
Thanks.
Thanks so much for this chat. I'm always,
you.
even, I talk about this all the time where it's the Bringing Up Baby podcast, but we're the ones bringing up the babies. So we're taking care of ourselves
Exactly.
and not always just thinking about the babies is really helpful. So I think this is going to be really helpful to a lot of people who are expecting, planning to be expecting again. And we know where to reach you. So thanks so much. I hope you have a great rest of your day.
You too. Thanks, Ashley.
If you're looking for more information or support along your parenting journey, check out birthbabysleep.ca. That's where you're going to find prenatal classes, postpartum and new baby resources, and sleep support during the childhood years. Lastly, but certainly not least, if you got something out of this episode or our show in general, leaving a rating or a quick review goes a really long way to helping others find us. So please consider leaving one. That's all for now. I'm Ashley Cooley, and we'll see you back here next time.